So EHAC is being aware of the early signs and symptoms of having a heart attack so that you yourself or someone you know can get early treatment. That may be chest pressure, pain, heaviness, fullness, nausea or vomiting. That may be pain to either the right or left side. Women, it's more common to have pain on the right side. You may have pain to your jaw or your neck area or also your upper back. Those things also can include shortness of breath. Symptoms are different for everybody. You may have intermittent symptoms that will come and go for a few minutes at a time. Some people have symptoms that continue continuously. The biggest part is getting treatment very early for those symptoms. The risk factors for a heart attack are early family history of cardiovascular disease, diabetes, high blood pressure, smoking, high bad cholesterol, which is the LDL, or low good cholesterol, which is the HDL, being overweight, and being sedentary, which is just being inactive. So women do not have really clear, obvious heart attack symptoms, unfortunately. Men usually have pretty crushing chest pain, break out into a cold sweat. Their pain usually occurs on the left side, which is classically what you see on TV. Women, it's more prominent to have pain in your right side, upper back, between your shoulder blades, and sometimes just a general feeling of fatigue or just not feeling well. Sometimes it's like flu-like symptoms, even with abdominal pain. Breaking out to a cold sweat can be a symptom. Shortness of breath can be a symptom. Just a general inability to perform exercise. The chest pain, like I say, can be crushing. It can be minimal chest pain, pain in the upper neck or jaw area. Getting urgent treatment is the most important thing that you can do for yourself. We have a nation standard of 90 minutes from the door to balloon time. So if someone's having a heart attack and has a clot in that artery, our goal is to get that opened up within 90 minutes to hopefully preserve the heart muscle. Do not drive yourself to the hospital during a heart attack. Do not drive yourself. Do not drive a loved one. It's very important to call 911. There are interventions that the ambulance can do for you that could save your life. They can also do an EKG in that ambulance, and if we can see that you're having a heart attack on that EKG, they can immediately notify the emergency room. They can get the team there, they can get the cardiologist there, and we can really start moving towards that 90-minute door to balloon time. So it's vital to call 911. Do not drive yourself. So you can lower your risk of a heart attack by controlling things like diabetes, controlling blood pressure, controlling your cholesterol, whether that's decreasing your LDL or increasing your HDL. Also, stop smoking if you're currently smoking, making sure you're getting at least 30 minutes of exercise every day. Eating a heart-healthy diet is really important. If you just think about your plate should look like a rainbow constantly. The meat on your plate should not be bigger than about the size of the palm of your hand, but you should have a lot of color with fruits and vegetables at every single meal. Knowing your numbers and knowing your risk factors is so important. People walk around all the time and don't realize that they have high blood pressure or high cholesterol. So those things are really important to have evaluated either with your physician or a cardiologist, and really being able to look at those risk factors and knowing those numbers and start making strides to changing those things, because heart disease is 80% preventable if you know those risk factors.